of foot, the skeleton of the foot is arched with a concavity directed towards the plantar surface of the foot. The arches of the foot are present right from birth, but due to presence of excessive subcutaneous fat in the soles, they are not apparent during infancy and childhood. There are two types of arches. Number one, longitudinal arch. Number two, transverse arch. The longitudinal arch is divided into number one, medial longitudinal arch, and number two, lateral longitudinal arch. The transverse arch is divided into number one, anterior transverse arch, number two, posterior transverse arch. Medial longitudinal arch. The medial longitudinal arch is formed by calcaneum, talus, navicular, three cuneiform, that is medial, intermediate and lateral cuneiform bones, and first, second and third metatarsal bones. The lateral longitudinal arch is formed by calcaneum, cuboid, fourth and fifth metatarsal bones. The longitudinal arches consist of two pillars, a submit, and joints. Medial longitudinal arch. It consists of two pillars, the anterior and the posterior pillar. The anterior pillar is formed by the heads of first, second and third metatarsal bones. The posterior pillar is formed by the medial half of calcaneum. Lateral longitudinal arch. The anterior pillar of the lateral longitudinal arch is formed by heads of fourth and fifth metatarsal bones. The posterior pillar is formed by the lateral tubercle of calcaneum. Submit. Talus forms the submit or keystone of the medial longitudinal arch. The cuboid forms the submit of the lateral longitudinal arch. Joints. The joints of the medial longitudinal arch are talocalcaneal navicular joint and subtalar joint. The joint of the lateral longitudinal arch is calcaneo-cuboid joint. Factors maintaining the longitudinal arches. There are three factors which maintain the longitudinal arches. Number one, bone. Number two, ligaments. Number three, muscle, tendon and aponeurosis. Medial longitudinal arch. The bony factor maintaining the medial longitudinal arch is sustentaculum tali. The bony factor maintaining the lateral longitudinal arch is superior surface of calcaneum. The spring ligament or plantar calcaneonavicular ligament and the ligaments connecting adjacent tarsal bones are responsible for maintaining the medial longitudinal arch. In lateral longitudinal arch, the ligaments are long and short plantar ligaments. The muscles or tendons responsible for maintaining the medial longitudinal arch are tibialis anterior and flexor hallucis longus. The muscles responsible for maintaining the lateral longitudinal arches are the tendon of peroneus longus, peroneus brevis, peroneus tertius and the intrinsic muscles of little toe. Transverse arch. There are two transverse arches, anterior transverse arch and posterior transverse arch. Anterior transverse arch. It is formed by the body of first, second, third, fourth and fifth metatarsal bones. So the first to fifth metatarsal bones forms the anterior transverse arch, which is a complete arch. The posterior transverse arch is formed by cuboid and the three cuneiform bones. The posterior transverse arch is incomplete. When the two foots are brought together, the posterior transverse arch gets completed. Factors maintaining the transverse arch. The tarsal and the metatarsal bones are the bony factors maintaining the transverse arch. Ligaments. Superficial transverse metatarsal ligament and deep transverse metatarsal ligaments. Muscles, tendons or aponeurosis. Tendon of peroneus longus, peroneus brevis and dorsal interosseous muscles. They are responsible for maintaining the transverse arch. Applied anatomy. Pes planus or flat foot. It occurs due to collapse of the medial longitudinal arch. Due to overstretching of the spring ligament and plantar aponeurosis, subluxation of the head of talus occurs. This results in collapse of the longitudinal arches. So it results in a condition called flat foot or pes planus. Pes cavus or arched foot is an exaggerated longitudinal arch because of contraction of transverse tarsal joints due to muscle imbalance. Marten's metatarsalgia. It is a condition in which there is a sharp burning pain in the area between the third and the fourth toe due to compression of plantar nerves.